Artificial intelligence is ushering in a new era of healthcare tools. These AI-enhanced tools range from ambient listening to streamlined practice management. But the AI-supported tool that I believe will truly transform occupational therapy is clinical decision support. To be honest, it often feels like we have more clinical decision barriers than we have support. Our current EMRs give us a set number of checkboxes, which massively pigeonhole our services. And honestly, often these set of checkboxes do not reflect the best practices that we teach here at OT Potential. But on the near horizon is dynamic point of service support that will help you choose the right assessments, set the right goals, and pursue the right treatment path for the patient who is right in front of you. This is honestly a lot to wrap our minds around, but if we do it well, I think we will future-proof our profession for changes to payment models and regulations, because this new level of clinical decision support will so drastically increase our value. In this podcast today, we are first going to review a new journal article that outlines clinical decision support across 6 domains and how it's being supercharged by AI. Then, to walk us through what's here now and what's coming soon for rehab, I am so thankful to welcome Brad Willingham, PhD, the Director of MS Research at Shepherd Center in Atlanta, Georgia, who has been focused on how AI is going to augment clinical decision support. So let's dive in. Welcome to the OT Potential Podcast, where we review new and influential OT journal articles, then invite on an expert guest to help us pull out actionable takeaways that you can implement in your practice starting today. Welcome to the podcast. I'm your host, Sarah Lyon, OTRL. And before we dive into this big topic of AI and clinical decision support, I wanted to let you know that this podcast may qualify as continuing education for you. You are probably listening to this podcast on a free podcast platform, but to gain CEU credit, you will need to be a member of the OT Potential Club, our OT continuing education platform. So let's begin by looking at our journal article, and then we will bring on Brad to discuss how this topic could play out in your practice. The article we are reviewing today is called Advancing Clinical Decision Support, the Role of Artificial Intelligence Across 6 Domains. This article comes to us from the Journal of Computer Methods and Programs in Biomedicine, and it was published in 2024. So this article begins with this big picture intro to AI in clinical decision support. The emergence of AI marks a new era of health tech innovation. AI holds the potential to significantly transform patient care, from diagnosis and treatment of specific conditions to continuous health management. This transformation is rooted in the rapidly increasing volume and diversity of healthcare data, which presents both opportunities and challenges. AI's advanced algorithms and machine learning capabilities enable data processing and analysis at unprecedented scale and speed. And honestly, it's hard to think of an area of healthcare that this won't impact. One major area that is ripe for advancement is data analytics within electronic health records. In these records, AI will be used to detect disease patterns, predict patient risk, and customize treatment based on individual genetic profiles, lifestyle factors, and disease history. This type of analysis will improve clinical decision-making, leading to huge advancements in personalized medicine. That has been our goal for a long time, and we really see the tools that will help us get there. So in addition to streamlining traditional EMR tasks, AI will support clinical decision-making by driving advanced patient monitoring, administrative efficiency, and knowledge management of the latest research into actionable insights. So that's their big picture overview of what's happening. What was the intent of this specific article? So given the diverse roles of AI in the care process, the authors of this paper believe that a comprehensive examination of its potential to improve clinical decision support is essential. This review aims to not only highlight the transformative impact of AI, but also address associated challenges in future directions of this technology. So, what were their methods to carry this out? The authors conducted a systematic review to identify studies that specifically addressed AI's role in clinical decision-making. Qualitative analysis was used to identify themes, evaluate the efficacy of different approaches, and highlight research gaps. Ultimately, 32 papers were analyzed for this review. And from these papers, they pulled out 6 domains of clinical decision support. So their qualitative analysis yielded 6 fundamental domains of clinical decision support and 12 relevant functions. So basically, under each domain, there were 2 functions. For the purposes of this review, I am going to walk through those 6 domains and their associated functions. In the article, they gave concrete examples of products that are actually on the market for you to look at under each of these functions. So I encourage you, if you're interested in any of these domains, to look at that article. I'm just going to flesh out a couple of them that feel most relevant to rehab therapy. So the first domain that they mentioned is data-driven insights and analytics. The first function under this is EHR analysis. So EHR analysis includes technology like Gatortron, which was developed with NVIDIA. It is essentially a large language model trained on clinical data. And this type of AI can be used to analyze EHR data for concept extraction, relation, extraction, and clinical inferences. Function 2 under data-driven insights and analytics is big data and predictive analytics. Here, AI is driving predictive analytics tools that are able to forecast disease outbreaks, identify at-risk populations, and foresee future healthcare needs. For example, the Philips company has been using predictive analytics to detect early signs of deterioration in ICUs, in general wards, and even inpatient homes, ultimately reducing readmissions. The second domain, which I'll just say the functions because this is more doctor specific, is diagnostic and predictive modeling. And the functions under that are diagnostic assistance and risk assessment and predictive modeling. Domain number 3 is treatment optimization and personalized medicine. The first function under that domain is evidence-based treatment recommendations. So AI is contributing to the standardization of care by analyzing personal patient information alongside data on evidence-based treatments. For example, an algorithm called Code ACS was developed in the UK to quickly detect heart attack risk. Using patient information like age, sex, heart measurements, and other test results, the tool determines whether a patient is likely to have suffered a heart attack and thus whether they should be sent home or kept in the hospital. The other function in this domain that I'll just say and kind of skim over because, again, it's physician specific, is drug interactions and personalized therapy. The fourth domain is patient monitoring and telehealth integration. The first function under this is remote patient monitoring. AI is transforming remote patient monitoring, particularly in preventative and post-operative care. Companies like Tinovi can monitor blood glucose levels, physical activity, and dietary habits, and then leverage AI to create personalized meal plans and exercise routines. The second function under this is telehealth and virtual care. And this is definitely a quickly evolving space. The authors specifically mentioned WellTalk, which was then bought by Virgin Pulse, which was then folded into Personify Health, which was then bought for $3 billion. So the focus on these preventative measures is very intense. There's a lot of money flowing into this area. The fifth domain is workflow and administrative efficiency. The first function there is automated administrative processes. The second function there is resource management and allocation. The last domain is knowledge management and decision support. The first function under this domain is evidence-based medicine enhancement. The authors don't give specific examples in this section, but I definitely encourage anyone interested in this evidence-based medicine enhancement to look at sites like Open Evidence, Clinical Key AI, which is from Elsevier, and UpToDate has also been working on a generative AI solution. And the last function is enhanced communication and coordination. Again, they don't give concrete examples in there, but definitely think communication across disciplines and communication with our patients. So those are the 6 domains that they lay out. Again, there's a lot of details that I skimmed over, but let's look at AI challenges in clinical decision support. As illustrated by the examples that I just said, many companies are already capitalizing on the clear opportunity to transform clinical decision support with AI. But there are also numerous challenges ahead, most notably data privacy, security, interoperability issues, exacerbation of health disparities, and ethical, legal, and regulatory concerns. Efforts are underway to develop explainable AI models and implement robust data handling protocols. But ultimately, collaborative efforts among technologists, healthcare professionals, policymakers, and ethicists are needed to maximize the benefits of AI while minimizing the associated risks. So, headed into the conclusion and future directions that they lay out in this paper, the authors state that future directions involve the development and refinement of ethical, transparent, and user-friendly AI systems, continuous professional development of healthcare personnel to keep pace with technological advancement is vital. If AI can be harnessed, it may lead us to a more efficient, effective, and equitable healthcare system, blending advanced technology with fundamental human values. Okay, now all of that kind of sounds nebulous and futuristic, but these companies are very real. These solutions are coming to the market. It's definitely starting with physicians, but you will be seeing tools offered to you in 2025. And I am just, again, so thankful that Brad Willingham is here to talk to us about the questions we can be thinking about as rehab professionals and just the baseline knowledge that we need. Dr. Willingham is the director of MS research at Shepherd Center in Atlanta, Georgia. In addition to holding a PhD and master's degree in exercise physiology from the University of Georgia, Dr. Willingham also completed a 4-year postdoctoral fellowship at the National Institutes of Health. His research has spanned both clinical and basic science domains, making significant contributions to the fields of rehabilitation, physiology, and cell biology. Throughout his career, Dr. Willingham has maintained a steadfast commitment to engaging in research aimed at improving health, function, and quality of life for individuals with neurological conditions. In his current role as director of MS research, he continues to pursue a patient-centered rehabilitation research agenda, focusing on translating technological innovations into more effective and accessible care strategies for people with MS. So without further ado, I will patch Brad into this podcast. Welcome to the podcast, Brad. It's great to have you.
Hello. Thank you so much for having me and the opportunity to be a part of your program.
I am so thankful you are here. Of all the topics I'm done, this is probably the closest to my heart, the one that makes me the most fired up. I just so want us to have the information we need right in front of us. And there have been so many barriers to that historically, but I think we're like heading into this new exciting era and we're just getting glimpses of it. But I'm so excited to like talk about what you're seeing and what's ahead for us on the near horizon. But before we get to all of that, I want to learn a little bit more about you, about your role at Shepherd Center, and just how did you become interested in this AI and clinical decision support realm?
Yeah, so my personal role, I'm the director of multiple sclerosis research here at Shepherd Center in Atlanta, Georgia. We're a private, not-for-profit rehabilitation hospital specializing in spinal cord injury, brain injury, multiple sclerosis. But we also have the Crawford Research Institute, which supports research programs that mirror those service verticals. So we have a multiple sclerosis research program, spinal cord injury research program, and a brain injury research program. Within the MS research program, we have quite a broad research agenda that aims to address the many problems faced by folks living with MS. So, of course, we have research studies focused on the development and implementation of novel care strategies or rehab technologies. But we also have studies in nutrition, employment, self-management. And so we have this real broad agenda, and we have a very diverse multidisciplinary team coming together to support that agenda. And another key part of that multidisciplinary team is our integration into the clinical programs. And so everything we do within our research program starts with a clinical need or a clinical question or a patient need, a barrier to care, and we work backwards from there to find a solution. And so we've established a robust knowledge translation infrastructure and culture where we regularly engage with our clinical staff and patients, and we ask, what are your needs? What are your questions, your barriers? Or here's what we're finding. What does this mean to you? Is this helpful? How do we get it into this information into the hands of those who need it? So that's an overview of the program that I'm so fortunate to be a part of. As for the question about how did I get interested in AI? AI emerged as a tool, as a solution to a problem I've been working on for quite some time. So that problem being, how do we make sense of all of the dense information we're getting from today's scientific instrumentation? So my work in cell biology and physiology focused on extracting scientific information from the dense information collected by near-infrared optics or electron microscopy. And so these instruments provide unprecedented insight into human metabolism, cellular structures, but it generates so much high-resolution data, you don't know where to begin. And so I was developing and applying different algorithms and machine learning approaches to extract and segment information out of that data. And then when I came back to my roots in healthcare, I actually started here at Shepherd years ago as a clinical exercise physiologist. I noticed that the same problem, and arguably one of the greatest challenges of modern medicine, is to extract meaning from the immense amount of information that's available to us. With the advent of, electronic health records and digital health technologies, wearable sensors, mobile apps, telehealth platforms, clinicians have a wealth of information available, but it's difficult to assimilate it, review the data, make sense of it. So AI provides a unique opportunity to address this problem, because one of the things it's really good at is ingesting, integrating, and extracting information from large amounts of data.
This is personally fascinating to me as an OT practitioner. My story is I went to school in New York University. I came back to my small town here in Nebraska, and I would literally have a patient walk in who has MS and is literally my next door neighbor. And I'm like, I want to provide the best care to this person. And Brad, I would feel awful about myself because I did not know what to do. And I'm looking at my EMR and it gives me my ADL checklist, basic information that I'm this doesn't fit an MS patient. I know at Shepherd Center or in places like that, they can get amazing care, but I don't have access to that. I'm emotional talking about that because it's so, yeah, this is my passion. How do we get this dense information not only to Shepherd Center, to therapists like me? Now I'm in continuing education and I get to see all the amazing research, all the amazing tools, but I know it's still not in front of us at point of service. We're still looking at these dumb 20 check boxes in these old EMRs. How is AI going to help with? Is that the problem? Am I capturing the problem well for point of service clinicians? And how is AI going to help that?
Absolutely. And, we talked about the challenge of capturing and integrating all of this information. And you highlighted another source. So some of that data is patient generating, right? So it's the EHR, it's the wearables, it's the digital health devices, but some of it is also what's available in the scientific literature. What are best practices? What are the guidelines? And this is another data source that needs to be a target as well. And so not just assimilating and integrating the patient-generated data, but also giving some context to that data with the latest research in that area or guidelines and best practices. And so I certainly think that's another area. In terms of, how does AI improve clinical decision support? There's so many ways. We almost have to focus to make it through this podcast because there's so many ways that AI may impact healthcare. So Nigam Shah, he's the chief data scientist at Stanford Healthcare. He was giving a talk one time and he laid it out that there's, three domains. There's the science of medicine, the practice of medicine, and then the delivery of medicine or delivery of care. And these AI has potential to make impact across all of these new discoveries, new evidence, new ways of practicing. And to me, clinical decision support kind of fits in that domain. And then the actual delivery and increasing accessibility to care and empowering patients with their own data, right? And so within this clinical practice domain, clinical decision support specifically, as I mentioned, I think AI is uniquely equipped to address the problem of ingesting and integrating the data. And that could include, again, patient-generated data or the latest and greatest evidence. Things like data fusion algorithms, semantic AI, knowledge graphs. These AI applications have a unique ability to integrate data from various sources. Then another issue in that is some of it is just too much. It's not necessarily the complexity, but if a patient has a wearable sensor, there's a lot of valuable information in there. Where do I start? It's taking a reading every second for, day in, day out. And so it's another opportunity for AI. So you can use recurrent neural networks or specific ML models designed to detect trends or patterns or anomalies. This is a way AI can help synthesize that as well. And so, not just let's see a graph of high resolution wearable data, but what's the trend? Is there progress? Is there regress? Do we need to have a change in our course? Is there an anomaly a couple weeks ago we should be aware of? But then even when we get the data integrated, we deal with these time series issues, it's still, where do we go from there, right? So once we have it integrated, then we can start layering on predictive analytics and even digital twin technology to integrate this data and create predictive models that say, okay, what are the predicted outcomes for this patient? What are the best treatments for this particular individual based on this comprehensive set of clinical characteristics? Evidence-based medicine, we've made tremendous progress in rehabilitation with evidence-based medicine, but there still is a need for the personalization of care, right? So not just best practices, but best practices for the individual. And so I think AI is really going to help with that through the development of novel biomarkers and predictive modeling to create more personalized and precise care strategies. The last thing that comes to mind too is, okay, we have the data together. We've analyzed it. We made some predictive models. We have some unique insights. How do we get those into the hands of the decision makers? And so this is where large language models are well positioned to deliver, right? So, of course, ChatGPT, how are you going to have a podcast on AI without talking about ChatGPT? Large language models have a unique ability to, integrate ingest data and disseminate the meaning behind that data in clear natural language summaries. And so rather than a dashboard that's showing the numbers, you can get a clinician a nice coherent paragraph, hey, these are the key things you need to know. This is what's going on. So when you put all those together, we're really transforming clinical decision support from a series of checkboxes and a single EHR interface to a clear natural language interface that is driven by and backed by a large, comprehensive, integrated pool of information about that specific patient.
Mm-hmm. I mean, I think we're going to look back and be like, that's amazing we were functioning at all without those tools. Like at the time I was feeling awful, but I'm now like, that's amazing. How are we even delivering any care without, or now that we see the tools coming on the horizon where it's synthesizing so much. And I do think they're going to provide just incredible support for us. Logistically at Shepherd Center, what does this look like for you all? Or what can you share about that? What's your mind been chewing on? Like you said, there's so many things that are going to change in light of how AI is going to help us. Like what specifically are you and Shepherd Center honing in on?
Yeah. And so, of course, when we get this layer, of course, there's a whole layer of data security and privacy issues that need to be addressed when you're operating, within the healthcare ecosystem. But in terms of just AI helping Shepherd do what we do best, I started my career here, as I mentioned, working in acute care and spinal cord injury as an exercise physiologist. And I oftentimes find myself reflecting like, okay, if we had this technology, then how would I use it? And two things immediately jumped out to me. And so clinical decision making here at Shepherd Center starts with the patient, right? It's establishing a deep understanding of the patient's needs, their abilities, their goals, their support systems. And so with all of the immense amount of data that we have available to us today and the wonderful, instrumentation we have to measure folks and assess folks and evaluate folks, we now have either the ability to get unprecedented insight into the patient's needs, abilities, and goals. And AI is going to help us harness that and integrate that, make sense of that, but also get input from the patient. And so these outputs from the AI, from the algorithms, from the LLMs, they're not just clinician facing, they're also patient facing. And so by making complex health information more accessible to patients, they'll be more informed and more empowered to advocate for their goals and communicate with their clinical staff about what they're experiencing and where they would like to go. And so I think it'll help clinicians get a deeper understanding of their patient, but also help the patient engage in that process more, which will then further deepen that understanding. And then from there, the next thing that jumps out to me is at Shepherd Center, we institute a very multidisciplinary approach to care. We provide service across a continuum of care, not just, from inpatient to outpatient, but also across the different disciplines. So MDs, PTs, OTs, rec therapists, exercise physiologists, all coming together constantly throughout the week to strategize and collaborate and come up with a care strategy that's synergistic across these different domains and really speaks to the person as a whole, right? And so if these clinicians are able to come together and collaborate and create comprehensive care strategies, AI is now going to help the data from those different domains come together. So you'll have the data that the PT and OT are referencing, the data that the MD and the exercise physiologists are referencing, all coming together as well. And so you'll have the collaboration and the harmonization occurring with the data as well. And so not just data-driven information and clinical decision support, but comprehensive collaborative data coming together. And so those are the two areas where it jumps out and helping us do what we do better, right? And the idea isn't necessarily artificial intelligence to replace, but augmented intelligence and to support, right? I love your use of, the word clinical decision support, right? Because at the current state right now, we're just looking to overcome some of these ingestion barriers of data, these interpretation barriers, and empower folks, augment decisions in a way where clinicians and patients can make more informed decisions about their next steps.
Mm-hmm. That's so helpful for me to hear, hearing those two focus areas, really integrating information from the patient, really personalizing according to a particular patient, and then like supercharging our interdisciplinary efforts. Like those are things that we're trying to do already. And again, when I think of practicing, I think of like feeling like a failure because I always knew that wasn't happening to the degree we would want it to. And that at Shepherd Center, you have an amazing models to do that. But like my standard small town hospital, like there's not deep like interprofessional integration. But I think these AI tools are going to help everyone with that and really supercharge it. But I don't know, it's just helpful to be like, it's supercharging what we were already trying to do. Kind of wherever you're working, we're all kind of trying to do those same things. In this like article that we reviewed, it really nicely went through like 6 domains of clinical decision support and gave examples of things that are actually on the market. I loved going through and like seeing what these companies looked like. And it talked about things like diagnostic and predictive modeling and treatment optimization. I really loved the last section on like knowledge management and decision support, thinking about really being able to get like a more full sense of the research that's out there and getting that in a way that I can digest as a clinician and help inform my practice. What stood out to you from this paper, and did you find it helpful how it just like broke it down into 6 areas? It is overwhelming because it's like everything all at once is changing. So
I was going to say the last thing you said was what really jumped out to me was I thought it was really helpful in a very straightforward way to break down the potential applications of AI into specific areas, right? Because it's a little overwhelming how many applications there are. It's like, with the invention of the iPhone, we didn't realize at the time how smartphones were going to become, ubiquitous and have endless amounts of use cases. And AI is the same way. And so it's a little overwhelming. So where do I start? But it's also kind of a catalyst, right? By laying out these domains, it can catalyze ideas. It can get clinicians and clinical researchers thinking about, hey, within these domains, what are the challenges? What are the barriers? How can AI help me? And so I thought the categorization of the application areas was very helpful. Obviously, within that, there's a stratification of risk and therefore a stratification of the level of research that's needed to get these applications operational. As you mentioned, some of them are already live, but there may be a different level of research rigor and validation needed for an application that's facilitating clerical and administrative tasks versus those that are making clinical decisions about care strategies or diagnostics. And so it's also helpful to think from an operations standpoint, if you're implementing these different applications, what is the risk? What is the level of validation associated with each of these? Because it's not the same for all AI. And so there may be opportunities with relatively low risk to use and implement out-of-the-box solutions today. Whereas some of the more organization-specific, field-specific, and high-risk use cases of AI may require some further development. And so that's another reason that laying out the domains is helpful. It's to say, hey, there are different use cases in different domains, but also the lift to get these applications operationalized is not the same for each. But yeah, that was the main thing that jumped out to me. The other thing, and I know it's probably your motivation for having this podcast, is if you look at it's the beautifully written paper and it reflects the current state of the literature, but rehabilitation is not mentioned.
Yes.
So we have, obviously imaging's been a leader in AI for a long time with image analysis and segmentation, genomics, and now some use cases in primary care and telemetry. But And nowhere in here is rehabilitation mentioned. And so it also highlights the opportunity that's there. And for researchers, the amount of work that's ahead of us, we need to get to work in this field. It's being demonstrated. This is the future of medicine. So it's time to innovate. And that time is now. And having a simple model or framework to think about the different use cases such as this is very helpful in establishing those teams and getting the appropriate clinical professionals engaged and patients engaged in the conversation to start developing, practical user-centered applications of AI.
For rehab, what do you think we're going to see first? And are there rehab clinical decision supports that I'm missing? I've been super interested in this and I'm like, where's our version of this? Are we going to get, is it all going to be piloted for physicians and then they'll try to translate it to rehab? In my personal opinion, I'm like, I don't know if that works because our thought process is so different than physicians. We need our own supports that reflect the rehab process. Is there a secret room where they're in the works and I'm missing it? Do you have access to the secret knowledge that's coming, or where are we at with stuff?
It's a great question, Sarah. There is no secret room. I mean, we conduct our research on the floor in the clinic. And, we like to engage as many folks from the community as possible. So no secret room. It's just in the nascent stages in rehabilitation. In some ways, that's good, right? A lot of the groundwork is being laid out. There are some AI infrastructures from other disciplines we can apply. But I think you said something very important but the needs and the clinical decisions and the type of evaluation that's required by rehabilitation is a little bit different, right? And so in a lot of cases, it will take the development of our own, nuanced and tailored AI tools, right? And some of our research is doing just that right now. I mentioned some of these needs, right? The multidisciplinary nature of rehabilitation. In some cases, in the case of neurorehabilitation, the length, right? In some cases, it's a lifelong journey, right? And so the ability to develop AI tools that have the ability to evaluate and inform clinical decisions over long periods of time, right? Even more data, right? So there are many things about rehabilitation that may require us to develop our own use cases. But there's some models we can use. So one example is digital twins. And so talked about machine learning and predictive models where you're using, large multi-component data to make predictions or forecast outcomes for a patient. We can also develop digital twins, which is a digital model of a patient, enter a set of outcomes about that patient. It develops a digital model. And then from that, it can predict outcomes. It can predict how a patient may respond to a specific intervention or a combination of interventions. Yeah. And Nathan Price at Thorne, he's doing a lot of work in this area of developing digital twins, I believe, in the area of Alzheimer's or mild cognitive impairment. And so looking at that work and thinking, how can we use that infrastructure in rehabilitation to meet the needs of our patients and, create precision rehabilitation? Other companies such as Charles Fisher at Unlearn, they're also, developing digital twin prototypes and demonstrating the feasibility and efficacy of these models in other fields. And specifically at Unlearn, they're looking to demonstrate how they can use digital twins to revolutionize our approach to the clinical trials. So if we can expedite research using digital twins, using digital twins to test out different interventions and create control groups, can we expedite research, expedite scientific discovery? And so not just create more targeted treatment strategies, but expedite the discovery of new strategies. Some other areas that, I think are going to be up and coming are the area of adaptive robotics, rehabilitation technologies. And so, robotics technologies such as, electrical stimulation cycles and other rehabilitation technologies, they generate an immense amount of information in real time about human movement, and the amount of electrical stimulation that's being applied, things like this. And so can we leverage AI to evaluate that data in real time? And so to tailor and control the robotics in real time and respond to the individual's needs in real time. Same with electrical stimulation. Can we evaluate the response to eStim in real time and use AI to calibrate it and adjust it as the patient is participating in therapy, so create more optimized robotics and FES strategies. And telerehabilitation, computer vision software. Now with a smartphone camera, we can now, just with a 2D video, we can evaluate different types of biomechanics. There's companies like Kimtai who've now created computer vision tools that provide instantaneous feedback based on a person's movement. And so, raise your arm higher. And so using AI to, automate treatment, both in the clinic or even at home, creating more accessible strategies. And then, of course, large language, already talked about some of the applications of that, but that's also going to expand. So if we look at, ChatGPT, it's trained on the wealth of information available on the public internet, and again, Nigam Shah talks a lot about this, about how the need for discipline-specific models, right? So not just, a general AI, but an AI trained on, EHR information or trained on data elements that are relevant to rehabilitative care. And so I think you point out something, very insightful in that there are some current products that we can use and apply, but a lot of this may require us to create rehab-specific applications.
I think that's just a really helpful way to think about it. Like, the technologies are being developed with, a lot of times, with physicians in mind, but we need to be imagining how we can use these same technologies with rehab in mind. Like, the core technology is pretty similar, but what that looks like in rehab, what we want to see from it in rehab might look slightly different. And we need to start using our imaginations to be like, what do we want to see? Both patients, clinicians, researchers, to be thinking about that together. Can I get some free advice and tell you how I've been thinking about clinical decision support for our community? And you can tell me like what I'm missing and blow holes in my ideas.
Absolutely. I don't know if I'll blow holes in anything, but
that would be awesome. That would be great if you were just like... I just get to do like these kind of conversations with, most of the times I'm talking to master clinicians, and I'm hearing like a similar way of how they practice, where they're incredible problem solvers. They usually have like a core problem solving training that they do. And then for the specific diagnosis they work with, they usually have like, some of them literally describe it as like a menu of their things that they work from with the patient, all guided by what the patient is most important to the patient. It's like very collaborative, but they also have like set tools that they know that they like. So I've started to be like, for each diagnosis, should I work with these clinicians to develop this menu of like, here's the assessments they tend to use for like POTS or Ehlers-Danlos. Here's the type of goals that they like copy and paste into their note, but then like finish with patient-specific information. Here's like the kinds of treatments they usually do and the research they're using to back them. And hoping with the idea that these then could help inform what we're seeing point of care. Because I see for physicians, they're drawing from like up to date, and they have these knowledge bases already. And as OTs, I'm like, we need to start building that. We need to put more effort into building what information we want to see point of care and how we want it distilled down. Like, we don't want to see everything. We want to see like the couple most impactful things. And let's build that based on what our best clinicians are already doing. And I'm sure it will evolve from there, but that's like version 1 of the idea. Is that like a good focus for the OT community currently? Like, what are like practical things we can be like? And I think thinking of like my role as like a continuing education provider, is that a good like practical thing that I can be doing?
Absolutely. And I think the feedback to your efforts speaks for itself. But absolutely, and it occurs to me within the context of this conversation, it's a direct fit to apply AI to enhance what you're doing. And so what you're pointing out, and we briefly touched on this earlier, is a challenge, right? It's there's a lot of evidence out there. If you plug in just oh, my clinical need, my specific rehabilitation interest that of that moment into PubMed, you're going to get 1,000 papers. I mean, where do you start? Some of those papers, a lot of those papers may not even be relevant to the patient population you're serving or the individual patient you have in mind. And so you have to go through these processes that you're describing that you are doing is, okay, what's the lay of the land? What does the scientific evidence say? Okay. What does the strongest evidence indicate? What are the limitations of this evidence? And then you're creating tailored, clinically informed guidelines or, flow charts or suggestions based on that, right? So essentially a clinical decision support tool, which is wonderful. There's a unique opportunity here for AI to contribute to that. And so, inputting all of the information, into a repository to make available to clinicians is a good starting point. But it's a little overwhelming, right? So if you're able to use AI to synthesize all of the literature, and pick out the reoccurring themes with the strongest evidence, what are the strongest trends, what are the strongest concerns, side effects, weaknesses of the evidence, it can then aggregate that for you and then assimilate it into similar clinician decision support tools that you've been talking about. For example, if we wanted to include guidelines or scientific evidence into a data repository with EHR wearables and other data elements, we may want to have some discretion over what evidence is included, right? And so your process that you're going through is a great way to do that. So I think AI could potentially help advance this project you've started by taking in all of the available evidence, bringing it into a consolidated format, and then you imposing your clinical judgment and acumen on top of that to narrow the focus and make it more clinically informed and tailored to the use case you have in mind. Another thing that comes to mind is this conversation that's out there about the ability of AI to reason, right? And so part of what you're doing, both when you're creating your clinical decision support tool that you just mentioned, but also when folks are using that to inform their care, is they're going through a clinical reasoning process, right? And so this is really the cutting edge of AI research, right? AI has demonstrated a profound ability to ingest information, synthesize, extract meaning, identify patterns, predict. But then the next step of that is to implement reasoning, in this case, clinical reasoning. And this is where we get in the area of transforming from clinical decision support to clinical decision making, right? Not an area I'm completely comfortable with yet. But in some lower risk use cases, we may be there soon. So it also, to me, represents an opportunity to develop AI tools that are informed and trained on clinical reasoning. So if you are able to tell an AI model to train a large language model, for example, on what clinical reasoning steps you're going through when you're creating that tool or when you're using that tool, then ultimately, in theory, you should be able to create an AI application that can implement that same clinical reasoning. So that's a powerful development project right there. Again, though, to your earlier point, we would need to do that for the different disciplines, for the different clinical populations, because there may be tweaks in that clinical reasoning depending on the specific use case.
Yeah, it feels like a project that would have taken like an expert clinician researcher 20 to 30 hours. Like AI currently can do a ton of the synthesis for you, but we still need that expert clinician to make it even like more specific to practice. Like that's kind of where we're at now. And then it's interesting to think about the next phase where like the AI will help, we'll be able to take over even more of that. That I can't really wrap my mind around. But yeah, I can see hypothetically how it's possible. I have emotion coming into this topic because it feels so important. I want to ask about like hopes, your biggest hopes for this, like, I guess confine it to the next 5 years. Like, not like, or even like in 2025, what do you think we'll see as rehab professionals? What's your hope there? And what are your areas of concern? What like critical questions do you want to put in our minds? Like, honestly, Brad, like I want to use the word tech bros. I have so many tech people in my LinkedIn DMs, like pitching me their ideas. Like, what critical questions do we need to have front of mind when we are confronted with new solutions? Because there's a lot of money going into selling new solutions to rehab professionals. And I think we need to be more critical and informed than we've ever been. So I guess start with the hopes and then ground us in the concerns and critical questions that.
Yeah, I mean, it's definitely efficient to limit, when we say hopes, like what time scale, right?
Yes,
And
yeah.
if you grow too far in the future, then it's like, well, the possibilities become nearly endless. In the immediate future, I don't, maybe 2025, I don't there. I think we're going to see the application of large language models to facilitate the interpretation and dissemination of complex health information in rehabilitation. So whether that's embedded into EHR and, the large EHR providers start creating their own embedded LLMs that summarize information, or it's, private organizations or innovators doing just that. One of the active areas of research in the MS research program is we are collaborating with some industry partners and some academic collaborators to develop customized LLM infrastructures that can integrate. They're specifically designed to integrate data that's relevant to neurorehabilitation and conduct analytics and then create clinical summaries that are directly relevant to care providers in rehabilitation. And so the application of LLM in cardiology to a clinical professional in that arena may be different in rehabilitation, right? And so we are developing a tailored large language model here at Shepherd Center that's specifically designed to, extract what our clinical staff feels are meaningful information and disseminate it in a way that's very accessible to our clinicians, but not just our clinicians, also patient-facing summaries, so that they can understand their information within the context of their goals. And so I think, that'll probably be the first place, we see some real tangible impact of AI within the next 12 to 24 months. Also, I think, we talked about, the implications of predictive modeling and digital twin. I think the fine tuning of those technologies and the advancement of those algorithms is going to ultimately help us realize this dream of precision rehabilitation, of truly individualized care. And it'll catalyze scientific discovery, as I mentioned. Overall, though, what does this mean? What is this going to lead to? It's hopefully, the hope is, as you asked, is leads to improved outcomes for our patients, right? So if we're implementing more personalized, tailored treatment strategies based on our AI models, then in theory, this is going to be more efficient, more effective, lead to better outcomes quicker for lower cost to go to the patient and the provider and the payer. and then also empowering clinicians to do what they do better, right? We're not trying to replace anyone. We're just trying to allow clinicians to spend more of their time and their intellectual bandwidth doing what they do best. And that is that clinical reasoning piece and taking the time to understand their patient's needs rather than investing that time in juggling this cumbersome, repository of data they've been handed by today's technology. And it's something, it's a little bit, if you allow me to speak to it, it's a little bit outside of clinical decision support, but I think it's really important to bring up. And that is this increased access to care. And so, when talking about the mission of our research program, it's to improve outcomes for the folks we serve, but it's also to do that through more effective strategies, but also allowing more people to access those strategies. Folks living with neurologic conditions face a wide variety of barriers to accessing care, whether they're symptom related or, geography, finances, social factors. So I think there's opportunities for AI to expand access to care as well through using remote monitoring technology. So we mentioned, wearables and digital health platforms. They provide a wealth of information. It's difficult to use that. We've seen some movement in the field to now offer reimbursement strategies through the release of the remote therapeutic monitoring billing systems. And so using AI to harness remote monitoring data to allow and facilitate remote care. So folks don't always have to come in, but they can get a comparable level of care from their home or the community or place that's accessible to them. We talked about computer vision technology, allowing us to evaluate patients' performance and safety while they're conducting rehabilitation exercises in their home. All of these are going to come together to allow patients to access evidence-based care more readily and, make care available to everyone with neurologic condition. So that to me is a huge benefit as well, a little bit outside of clinical decision support. But, there are risks. There's risk and concerns. The risk are heavily associated with data privacy, security, things like this. So these are always at the forefront of any AI research project. Before we even get off the ground, there's, hey, listen, this isn't just a purely academic exercise. This is developing a tool to be implemented in a real-world healthcare setting. So there's a lot of regulatory, aspects of the project we need to consider, particularly those surrounding data privacy and security. Fortunately, some folks such as Microsoft and others are now offering enterprise AI solutions that do come with the security measures needed to handle PHI, and they are HIPAA compliant. And so these tools are really accelerating AI research in the medical space, because it's wildly inappropriate to use just your everyday commercial AI platform and enter any kind of information in that. But if you have a model, if you have a GPT-4o or a Llama that's available to you in a secure environment, then you can rapidly test the solution and innovate in real time. Another concern is the bias within the algorithms in the models. This is particularly important for folks in the neurorehabilitation field, just due to the vast heterogeneity that we see in our patients, right? So, for example, folks living with MS, they experience a wide range of functional impairments and symptoms. So if we're training models, so for example, a predictive ML model to forecast outcomes, or, a digital twin application that allows us to simulate different interventions, if those models are only trained on a specific cohort of patients, then they're only going to be effective in that specific cohort of patients. So it's important that we consider when we're training these models and developing these tools that we're, training the models on very diverse patient populations, both from a pathology and disability standpoint, but also from social determinants of health. And so to accomplish this, we're going to have to establish, multi-site collaborations, right? And, NVIDIA is coming out with some great tools to facilitate federated learning. And this is a approach where centers can share in a secure way. They can share their data about their patients from different centers. And so by broadening that aperture of the data collection, we can then get a more diverse sample and train models that are more robust and more inclusive to those with, a diverse set of clinical needs. Yeah, I mean, and access to the technology itself. I mean, Mustafa Suleyman, the CEO of Microsoft AI, he wrote a book called Becoming Wave. And in there, he talks about how, the two sides of the potential of AI. It's so powerful. It's an opportunity to revolutionize care and drastically improve outcomes. But within that power comes, the consideration of, so therefore, due to how this technology is distributed and made accessible, it can either broaden or widen health disparities, or it can start to bridge that gap, right? And so it's important that as we develop these tools, we also consider ways to make them available broadly and accessible, because there is an opportunity for AI to bridge the gap between some of these high resource and low resource healthcare environments. But it has to be, strategically made accessible in an even manner. And so, yeah, those are some concerns that come to mind. But I think the benefits are worth it. And there's lower risk use cases to start with, right? To test it out. To say, hey, is this working? What is the error rate? What are the safety concerns, data security concerns associated with it? And then as we move forward, we can do the research to make sure that the application is valid and escalate it to higher and higher use cases as we sharpen the tool, make it more reliable, and do the research to support it.
Yeah, your last point about will the future be equitably distributed just anchors back to my heart, hope, and concern of I just being someone in rural Nebraska, a low resourced area, and wanting to provide that best care that I know is happening at other parts of the country, and wanting to offer that best care, seeing AI as a tool that can help so many people increase the value of their care, but also being afraid that some of us will get totally left behind is the inverse of that fear. And that's a big question. This feels existential. I could lay on my couch and think about it for days on end. What are some action steps that we as thinking frontline clinicians, what should we be doing today to get ready for this?
Ask questions and use the technology. So, I'm very fortunate to be in an organization where my leadership just has a wonderful vision about the future of rehabilitation. But it's important across all organizations that clinicians are asking about this. We see this being done in other areas. We see this being AI being used in cardiology, oncology. What about rehab? Is this something that we see as a part of our vision? Is this something we want to support? Start that conversation and use the technology yourself. There's some very low cost and free tools available that you can use. Obviously, you can't use it within clinical practice, but start to, test it out yourself, using, just your personal use cases and get you familiar with it and start, kind of turning those gears of how you might use it in your practice. I think it's going to go a long way. Rightly so. There's a lot of hesitation with the adoption of this. I think the power of the technology is realized, and therefore there's some justified hesitation with implementing it, and of course the security concerns. But I think it's my perspective and my belief that if the patients see the value, then it's the responsibility of those who support the patients and the clinicians to explore it. Is this something that we're interested in incorporating? Are there solutions available that are affordable and secure that we can start implementing immediately? And so I think, it has to start from the floor and work its way up into, the research laboratories and the innovation spaces. So yeah, I think that's the immediate call to action is to be curious and jump in and start using it, and be specific about the use cases where you can use AI in your work. Be specific about the value that it can deliver, because if there is value to the patients, if it can improve outcome, if these technologies can improve access to care, then they're certainly worth exploring.
And it feels like these tools are evolving really quickly. They're way more flexible than like some of our previous waves. And so clinician input does actually matter. Like, honestly, it feels like we've been in a phase of healthcare where we had these set tools and our input did not matter that much. But in this new era, I think clinician input matters so much and can actually be implemented in unprecedented ways.
Could not agree more. I mean, I'm actually giving a talk this Friday about the importance of co-innovation in implementing out of the gate, implementing co-innovation, research and innovation processes that engage users, clinicians, patients early and often. So have those co-ideation sessions, have those co-development sessions where you're talking about the problems, talking about the solution, test the solution, get input, refine it. So you don't want to just be walking around with a shiny new hammer and looking for a nail, right? You need to start with the folks who are facing the challenge every day and create a solution that is practical and meaningful. And so, yeah, I cannot advocate enough for, clinicians being engaged in research. And, fortunately, we're seeing that a good bit now, both in academia and clinical research environments, and even mandated by the funding agencies that, hey, this is a great idea, but you need to engage the folks who are going to use it early and often. It needs to be an informed solution. So could you agree more?
Well, Brad, this has been so much fun. I'm so thankful that you have turned your research eye to this and your efforts, and we are like cheering you on to lead us forward as rehab therapists in this. My mind's thinking about so many things. Is there a final thought you want to leave us on today?
No, other than, I appreciate you having the courage to take on this topic. It is, as you mentioned at the top of the call, it's a little nebulous, right? There's a lot of uncertainty, but that uncertainty, we can bring order to that chaos by having these discussions and finding out, okay, what are the actual applications? What are the ways we can get started right now? And so it takes, the courage of, scientific and clinical communicators like yourself, as well as innovators and researchers, to take a step out into this domain and advocate for the use of AI in rehab. And so I'm just honored to be a part of a research organization that's doing that, and to be a part of your program and to start this conversation. So thank you so much for having me.
Thank you, Brad. Wow, you all, this was a nerdy episode, but it is also one that just cuts to the heart. When I founded OT Potential, it was to help OTs provide better care. And I really do believe that the technologies that are emerging are going to help us at the point of service in ways that are honestly hard to fathom. I hope you join us in the OT Potential Club to be a part of this journey. We are working so hard to build clinical decision support in the club and meeting with companies to understand how this information could be presented to you at the point of care. The OT Potential Club is also where you will go to earn a CEU certificate for your time today. What you are going to do next is head to otpotential.com and either sign in or sign up for the OT Potential Club. Once you are in there, you can take a 5-question test, and when you pass, we will generate a certificate for your time today. Okay, I want to thank you so much for joining this conversation. I hope this podcast helps keep you informed and inspired as an OT professional. Take care, and we'll talk next time.